Well, good afternoon. It is a Friday afternoon, a beautiful Friday afternoon, as a matter of fact, and we'd like to welcome you to the Flint Community Webinar on Coronavirus. This is week 61, and we're glad that you are joining us to be a part of this wonderful event today. This webinar is sponsored by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, along with the Prevention Research Center of Michigan. I'm delighted to be your host today, Yvonne Lewis, a co-director of the community core of the Healthy Flint Research Coordinating Center. And I'd like to acknowledge all of the partners of the Healthy Flint Research Coordinating Center, represented by Michigan State University, University of Michigan Flint, and Ann Arbor, and of course, my co-director, Ms. Tanya Turner. We are excited to have you join us today as we look at issues around mental health. This is Mental Health Month, Awareness Month, and we're going to be sharing some very important things with you about how we can stop the stigma of mental health. We also want to acknowledge today that this month is Asian American Pacific Islander Heritage Month, and encouraging all of you to let's acknowledge that the heritage of all of our communities is important, and we want to specifically focus in your attention in some of these areas on the Asian American Pacific Islanders. Today, as I said, this is 61 weeks that we've been coming to you with this webinar, bringing a local flavor, putting a local context to what's happening with the global pandemic and related issues. And so we're excited to have these partners that have joined us from the very beginning to now, over 40 partners from the city of Flint and Genesee County that have helped us to bring this information to you. And today we have a very special webinar planned for you because we want to get your involvement and input on vaccination administration. As we also talk about mental health and crisis intervention, we're going to get an update from the governor's office, and we'll talk about COVID treatments, and of course, public health policy update is so critically important. I'd like to welcome our panelists that are going to be a part of our roundtable this morning. And I see Dr. Pam Hackert has joined us. Good morning. Brother Clarence Pierce, and they tease me, Brother Clarence, because I always call you Brother Clarence Pierce. And we also have Dr. Deborah Verholden and Dr. Susan Wolford, who will join us in this roundtable. As we prepare for the roundtable today, we're going to ask for your input. We're going to do a brief poll this morning. We've done the poll before. We're going to launch a poll in just a few moments because we want to find out some things from you as we've talked about this whole issue of COVID, vaccines. Where do you rest on it? Will you get it? So our first question for our poll today, and for those of you that are listening, you've joined us by telephone, hopefully you'll look at the webinar in future and you can just think about these questions for yourself. But our first question for today, and we'd like those of you that are in the webinar, please complete this poll. How likely are you to get the COVID vaccine? We asked this question a few months ago, and now we're going to just investigate it again. How likely are you to get the COVID vaccine? I would not get it, I'm undecided, or I would get it, or I have already received the COVID vaccine. So please, participants, complete the poll at this time. The next question that we have as you're completing the poll is, what factors are influencing your decisions not to get the COVID vaccine if you have not received it? And those responses are: I do not have enough information to make the decision, I weighed the risk and benefits and choose not to get it, or I do not trust the system. We're asking you, please complete these questions at this time. And I see the questions, the responses are coming in. Thank you. Responses are coming in. Good. Additional questions. I do not trust the message. I do not trust the messenger. And this is whether or not you get the vaccine. You can see those questions. I see the answers coming in. I am a good candidate. The provider has not said I should get it. Oh, you're answering all those questions. Question 3, what factors are influencing your decision to get the COVID vaccine? Thank you, thank you. I see those answers coming in. Question number 4, for those of you that can't see the question. Question number 4 is, has open access to COVID vaccines reduced barriers in vaccine administration in the Flint community, in your opinion? The responses were yes, a lot, yes, somewhat, not really, not at all. Thank you for getting those responses in. A couple of more questions. A COVID vaccine is now available for children ages 12 to 15. Hot topic. How likely are you to have your children vaccinated? You got to join us next week. We're going to talk about this. I couldn't wait on that one, Dr. Wolford. I know that's a hot topic for you. Thank you. I see those responses coming in. And then our last question for the poll today is, are you in favor of children ages 12 to 15 being administered COVID vaccines? All of those questions are coming in, and I do see your responses. 46% of the responses are in so far. They're coming in. We're about 68% of those of you that are in the webinar. If you would complete those responses for us, we would certainly appreciate it. We're almost there. 71% of you have completed the poll. We're going to allow just a couple more seconds on this because we've got information we want to share with you. And it looks like, I'll go back to the top as it looks like the majority of the participants in the poll today, about 91%, have already received the vaccine. For question number 2, what factors are influencing your decision? Wow, none of the above. I would have gotten the vaccine. 86% would have gotten the vaccine based upon the information that has been made available. Question, what factors are influencing your decision? We've got the responses in, and we've got about 49% that said, I have enough knowledge to make an informed decision. And this is great, high numbers, 66% believe the vaccine saves lives, and about 60% said, I trust the message and the messengers that the vaccine will do more good than harm. There are some anonymous answers that are coming in too. So we're gonna, number 4, how about access? The access question. There's a lot of access. 47% said we believe we have a lot of access, and 42% are saying somewhat. So that's a positive there. Question number 5, a COVID vaccine is available now for aged children. Now, 81% said I do not have children in this age. So we're going to talk about what that means for us going forward. And the second question on children, are you in favor? We've gotten 79% of those of you that are in the webinar today saying yes, yes. So I want to talk to our panel today. Thank you for completing that poll for us. We appreciate it, and we'll have future polls coming up. We'll have polls coming up in the future to talk more about this. So Dr. Deborah, Brother Clarence, Dr. Hackard, and Dr. Wolford. Dr. Hackard, I want to start with you. We had a lot of questions early on about vaccine availability, and I know you have taken great steps to help in our community get additional vaccines and make sites available. And can you talk to us about some of the things that you put in place to ensure that vaccines are going to be available for our community?
We have had some very exciting news. I mean, this has been a really good week in terms of, being able to really provide additional services to people. The Curative Lab site, which is a partnership we have with a national company, but it's at the Diplomat Pharmacy building on 4100 Saginaw Street. That is something we have not been able to offer before. Is Sunday vaccines, 10 to 8 o'clock, every day except Monday. Vaccines it's open. You can either walk in or you can make an appointment, and that is from 10 a.m. to 8 p.m. They are also starting to administer the 12 to 15-year-olds. There are special hours that are just going to be for the 12 to 15-year-olds, which I think is wonderful. And that is on our website. You can link for an appointment at gchd.us. And then it will have a spot at the top where it says vaccine appointments, and or maybe at the side. And then go on that, and then it has all of them listed there. It has it for the 12 to 15-year-olds, and it also has the additional times available for the others. Not as many people are asking for the Johnson & Johnson, but again, that does meet all the qualifications to be considered fully vaccinated 2 weeks after the one and done Johnson & Johnson. And there are appointment spots if you want that vaccine as opposed to the 2-step of the other ones. So that's really good news. But also then with that partnership, we're able to free up a lot of our health department staff so that we've been able to do outreaches into additional areas that had not been reached before because they were anticipated to be smaller clinics. I don't have the list in front of me, but I know we're working with some of the housing complexes in the area, as well as some of the more distant communities as well. Because as I know has been discussed before, the most vaccine hesitant has actually been identified now as more of our surrounding cities, villages, and townships. And so that's the vaccine availability. But I'm sure everyone has heard about the new orders that if you are considered fully vaccinated, that is opening everything up now. The governor just sent out some updates about 15 minutes ago, and we will be following basically what the CDC guidelines are. So hooray!
More to come and more opportunities. Now I want to ask Brother Clarence, you're at the Hamilton Federally Qualified Health Center, and you're opening up also for walk-ins. This is another thing, no more registration, everybody can just walk in. How is that impacting the availability and possibly some wasted vaccines? Is there a concern about that?
Yes, Yvonne, there is a concern about that. Ideally, if you're just doing the J&J, the one and done, it's much easier to coordinate. Having to do the 2 shots, one, you have to make sure that the person can get back. And of course, transportation is an issue here in the community. And I want to thank the MTA for giving us some funding to ensure that people can get a ride for their visit. So that's going to help us. And I think that a lot of the people that we're actually coming in contact with now are saying, well, I don't really want the J&J because of the negativity that they've heard about it. And so they're electing to go with the 2 shots. So we have been hurt a little bit by that negative press that J&J had. But all in all, we're seeing the numbers really decline. We are seeing a lot less than what we were. And we're trying to encourage people to come in. We're doing commercials. We're putting print media out there. Our website. So we're doing everything we can to try to encourage people to come in. And we're hopeful that we will see some results from that very soon.
So Brother Clarence, you tapped into something that's very near and dear to Dr. Deborah's heart, and that's that data. And I know we were talking earlier, she was telling me about what's happening with the small percent change that we're seeing in the number of individuals who are getting vaccinated. So she talked to me about a 2% increase in newly vaccinated individuals, 31 to 44. And then she also said only a 1% increase in those who are fully vaccinated. Dr. Deborah, can you talk to us more about the significance of this and kind of what this means for us as a community?
Well, I think we've done a pretty good job so far at dealing with our barriers. The thing I love about this community is we are very forthcoming about the challenges that we face and very collaborative in addressing those challenges. But just like we're seeing all across the nation, the rates of people getting that first shot is started to level off, and the pace at which people are fully vaccinated, whether it be they got their 1 dose of a 1-dose vaccine or they got both doses of one of the 2 doses, are starting to slow down. It's important that we monitor the data each week, in my opinion, just so we know where we are. But I think, it sort of lends itself to all of the work that we now have going on to get all hands on deck and everybody in the community engaged in this major public health outreach effort.
So thank you. So Dr. Hackett, I want to just jump back to you for a minute because you've not been selfish about this at all. You know, the health department is on the front line, but you've embraced others, our pharmacies, the hospital partners, whoever is able to do vaccines. So one of the questions for you is, what about vaccine confidence? What's being done to promote confidence in the vaccines? As Brother Clarence mentioned, there have been some questions about the J&J, which may have impacted people's confidence levels. So what are you doing in that regard?
Well, I think one of the most powerful things also is data. And if you look at the number of people who had been infected by the what was pausing it, which was blood clots at the same time your platelets were falling. So you were getting blood clots and also had more propensity to bleed. You were more likely to start having a bleed. That occurred in 15 people, I believe 3 of who passed away from it in over 6 million shots. So the risk of that is, 1 or 2 per million at most. Right now, our mortality rate associated with actually getting COVID infection is 18,000 per million. And we know that these vaccines are safe. And there was a lot of debate at the beginning, like amongst medical professionals, like, should they have even paused it for that low number? And normally they would not, because all vaccines have an airplane. Someone keeps calling me, sorry. Even like an airplane flight has a risk of blood clots, quite high. But also we know that this does happen occasionally and rarely. But it was the certain circumstances with this one that they decided to pause it, thinking that they would, give a feeling of safe and security to the communities. But when it was such a low number, a lot of people did say, well, was that really the right thing to do when so many people are dying of COVID? Did you need to pause it? So there's still some debate on that as to whether or not. I personally like the fact that they paused it so that we could make sure that everyone did feel secure, at least retrospectively, saying they paused it because they don't want any chance of unusual circumstances.
Well, thank you. So
but I was just going to say, one of the biggest things about all the vaccines and the fact that it's Johnson & Johnson, Moderna, and Pfizer is the new orders that have come out from the CDC saying if you are fully vaccinated, you can go back to your life as it was before. Remarkable. I don't think many people saw that coming. And so it's just remarkable. And it ties in with a nice segue to the mental health aspects of this. So the list that they have, go to an indoor movie theater, attend a full capacity worship service, sing in an indoor choir, eat at an indoor restaurant, participate in indoor high intensity exercise classes, things that, we had been saying, oh no, we can't do that for a long time. Yes, we can. Even if the person who you are with has chosen not to receive the vaccine, they should be masking for their own safety, but the people who are fully vaccinated are considered safe.
Thank you, Dr. Hackett. And when you talk about building that confidence, transparency and being open with the process is really important in improving confidence. I saw you wanting to jump in here, Dr. Wolford. When we talk about confidence, now we don't want to get too deep into it because next week's topic, but how is this confidence level going to, from your perspective, dealing with beginning to vaccinate younger people?
So I think that I really agree with all that has been said and the importance of data. There's also the importance of sharing one's story. So if you've had the vaccine and you now have more hope, you're able to get on with your life, you didn't have, you had some side effects showing that the vaccine was working, but you made it through. I think it's important to share that, because as you share that, then others who are influenced by you will be more likely to get that vaccine and maybe more likely to get their children vaccinated as well. So I think that we shouldn't hold back. We can't tell other people, you've got to do this or you've got to do that. But I think it really makes a difference when people hear from somebody who's had the experience, who may have been a no before and now actually went ahead and did it. If we can share that with others, I think that will encourage some of those who are still hesitant to go ahead and get the vaccine themselves.
Thank you, Dr. Wilford. Now, Dr. Deborah, you're back up again here too, because we're talking about a data point, that, as I call them. But we talked a little bit about this 1 dose, 2 dose, fully vaccinated. Kind of clarify this whole thing, because if you can, and maybe Dr. Hackett want to jump back in here too, because even after getting the 1 dose or the 2 dose, there's a period of time before one's considered fully vaccinated. Is that correct?
Yep, there's that nice little 2-week window. So we heard about the 96% effectiveness rate. Well, after you get your first dose, you've got some protection. It takes about 2 weeks to get that initial protection from a first dose if you get a 2-dose vaccine. And to get that full protection, you're looking at 2 weeks after you get your second dose. And that really is giving people getting that dose within the specified time window. And it varies as a function of which vaccine you get. The whole point in this is to make sure that people have good information. We don't want you to go get your first shot and then think, okay, I'm good, and start living your best life, right? The whole point is prevention. We want to prevent people from getting sick in the first place. And the best way to do that is to continue to honor the protocols. Wash your hands, wear your mask, watch your distance. Get your vaccine. Give it 2 weeks after you get your full dose, whether it be the 1 shot of the J&J or 2 doses of the others, and just stay the course. It not only will protect you, but it'll also protect others and people around you, people that you may encounter who, for whatever reason, might not be eligible to get the vaccine, or people who might be, somebody asked me a question on the radio this morning. They were finishing cancer treatment and said, my doctor has told me that I shouldn't get the vaccine just yet because my immune system is very weak right now. And I said, well, if that's what your doctor told you, then you should follow your doctor's orders. Can you imagine encountering somebody who's had to battle cancer during COVID, and you're standing in line behind them in the market, unmasked, maybe vaccinated, not realizing that you potentially just breathed it in somewhere and could be breathing it out on somebody who's already battling health? I just want to encourage people to elevate their sense of collective responsibility and community. Getting your vaccine and wearing your mask is something that you can do for you, but also for the many people around you who you will never know what they're dealing with.
Thank you, Dr. Hacker. Did you have, yes.
I mean, how can you argue with that? It is important. It's always important. And, it's actually not even just COVID. I mean, there's other, illnesses that are transmitted, and we do need to be aware of that. And I think we're going to be more aware of that this coming fall with, flu. We had remarkably low flu numbers, and that saved so many lives. But yes, I mean, those are the exact same things.
So one of the questions that came up in the queue, and you touched on it a little bit, Dr. Deborah, says, do you think we should ditch the mask after getting the vaccine, being that I know you can still get it? So I see you shaking your head. Both of you are shaking your heads no.
And I'm going to shake my head no. And I know that the CDC just came out with a recommendation, and people may have questions about it. So how I'm asking people to think of that as a recommendation, but that's why we do this webinar and a lot of the other outreach. I think it's one thing to give people a recommendation. I think it's something altogether different to give them a lot of the insight and the understanding that is underneath of those recommendations. So I worry that people may take that recommendation without understanding what's underneath of it and say, well, I'm vaccinated, I don't need to wear my mask, indoors, outdoors, etc. That is not what should be happening right now. I do think there's a new opportunity for engagement. If you are in a small group of friends or family and everybody in that small group is fully vaccinated, that's a new opportunity for us, for people to have the experience. I love the Michigan campaign that they've launched around why I got vaccinated. And it really moved me when so many people said, because I wanted to hug my mom, I wanted to hug my grandma. And I would bet that a lot of the people who've lost their moms and grandmoms and family members to this disease would agree with that. So yeah, there is a new opportunity there, but you don't have the right to ask somebody if they're vaccinated. Imagine you're in a store and somebody comes up in line and gets really close behind you and is unmasked. You might feel some type of way about that. I think we all just need to continue to be good stewards of the opportunity to get the vaccine. If you are vaccinated, feel good about the heightened personal protection that you have, but also, really practice that collective responsibility and continue to wear your mask, when you are in public places and when you are indoors.
So I have one thing to add to that, and I agreed. And it's so hard sometimes to read the footnotes or to read the little bullet points at the end. So at that end of the chart that many people I think have already seen about everything's green, no mask, no mask, it does say CDC cannot provide the specific risk level for every activity in every community. It's important to consider your own personal situation and the risk to you, your family, and your community before venturing out. So I think that they probably should have put that at the top, not at the very bottom, because people get excited reading all the other part and then they don't read the end. But that is exactly what you were saying.
Yeah, I think people are rushing to the normal because they're just over it. We're all over it, but the virus is not over us, and the pandemic is not over. And I used to say, maybe 8 or 9 months ago, we're still in the middle of this thing. And Dr. Reynolds say, do not tell people we're in the middle of this thing because we don't know where the middle is.
Yeah.
What we do now know after more than a year of dealing with this pandemic, we know what works. We flattened the curve with prevention. We didn't have the vaccine, and all of that good prevention helped us to get the rates down and slow the spread. If we can keep those things in place, the vaccine has the potential to be the real game changer to help get us across, the real finish line of being able to say we've gotten out of the epidemic proportion of COVID, and we're now going to have to deal with what will COVID look like endemic or just now a part of our society. So I just can't stress it enough. Just stay the course, people. A recommendation is just a recommendation. My mom used to say, if your friends jump off a bridge, are you going to jump too? Don't stop wearing your mask because your friends are doing that. You be the person in your community and in your sphere of influence who encourages others to continue to wear their mask, because you as a leader and somebody that has concern for our community models that same behavior.
Thank you, Dr. Deborah. Dr. Susan Woolford, I'm going to give you one quick second to have your remark. And then Clarence, I want you to come back and just share with us real quickly before we move to hearing from our state, from Gary Jones. Dr.
I'm just gonna agree with what has been said. We are our brother's keeper. That the recommendations also said that you still have to wear your mask in a bus, on a train, on a plane, in the healthcare setting. I absolutely agree. Neither the first nor the last. Don't rush to take it off. Be cautious, protect yourself, and protect those in your community.
Thank you. And Brother Clarence, I know you're still over there at Hamilton, wanting to make sure that people get their vaccines and that they know you're available. So please, thank you to our panel today. Let's utilize the resources that we have available and make sure all the work that's being done is not being done in vain. We want to thank our panel, and for those of you that participated in our poll, we appreciate you. We want to continue to hear the community voice, because Brother Gary Jones here, who comes to give us the updates, believe it or not, he's taking some of the information from the webinar back to the governor's office. So Gary, give us an update, please.
Yeah, thank you, Yvonne. Actually, I was taking notes during the time. That's why I was off camera. So I didn't want people just seeing the top of my head during the entire time. So absolutely, thank you, everyone, for the feedback and the information. Just a couple of things I just want to talk about, and actually some of them were already referenced earlier in the roundtable discussion. But today, the governor announced the Michigan Department of Health and Human Services is updating the gatherings and mask order to align with the CDC's latest guidance on face coverings. The new order will take effect tomorrow, actually at 9 a.m. On Thursday, as noted earlier, the CDC released updated guidance recommending fully vaccinated people no longer need to wear a mask or physically distance in any setting, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local businesses and workplace guidance. Under the updated MDHHS gatherings and mask order, Michiganders who are outdoors will no longer need to wear a mask regardless of vaccination status. While indoors, fully vaccinated Michiganders will no longer need to wear a mask, but residents who are not vaccinated or have not completed their vaccinations must continue to wear a mask or face covering to protect themselves and others. After July 1st, the broad indoor mask mandate will expire. Earlier this week, we had the Lieutenant Governor receive a second dose of the safe and effective Pfizer vaccine at Burston Fieldhouse in Flint, where he launched the Making Real Change tour to promote vaccinations in cities across the state. Special thanks to Dr. Bobby for administering the vaccine to LG during his stop in Flint. The Making Real Change tour itself will highlight the administration's continued efforts to flatten and eliminate racial disparities during the COVID-19 pandemic, focusing on what the state has learned in order to apply those lessons to equitably administer vaccines, and what the state is doing to build the resilience required to close racial disparities in health and other areas within communities. The governor also recently announced that 55% of Michiganders have received their first dose of the safe and effective COVID-19 vaccine. The announcement marks the first milestone of the My Back to Normal plan, which will enable in-person work to resume across all employment sectors on May 24th. The Michigan Department of Health and Human Services will base future epidemic order actions on vaccination-based milestones that, once achieved, will enable Michigan to take a step towards normalcy. And finally, the governor released several proclamations to recognize our heroic frontline workers, including teachers, nurses, skilled nursing care, school nurses, and EMS. The governor has taken several steps to provide support to our frontline workers, including a $2 per hour wage increase for skilled nursing workers, the My Classroom Heroes grant to give back to our educators who are going above and beyond for their students, the First Responder Hazard Pay Program to reimburse our first responders, and a first of its kind Future for Frontliners program to provide frontline workers tuition-free education or skills training. And finally, always plug in the websites, michigan.gov/COVID vaccine and michigan.gov/coronavirus, still both the best catch-all websites for all updates.
Thank you so much, Gary. And we certainly appreciate you coming every week when you're available to share with us what's coming from the governor's office. But we too appreciate you taking things back to the governor's office on our behalf. So thank you so much. As we talked about earlier, this is Mental Health Awareness Month. And today we have with us Jennifer McCarty, who is with Genesee Health Systems as a clinical and macro analysis there, and looks at is the senior director for clinical performance and innovation. Innovation, this is a new thing that's happening that she's going to be talking to us about. And when we talk about mental health, we're concerned about COVID, but we're also concerned about the overall health and well-being of our community. So crisis intervention is key. So Jennifer, please help us to understand all the things that's being stood up at Genesee Health System to help us in our community.
Hi, everyone. So early on in the pandemic, Genesee Health System had unique opportunities to apply for some of the COVID response grants that were available through the federal government. And we also had the opportunity to redirect some of our existing grant funds to do some program development that might really help our community during a huge time of need. And so Genesee Health System is always committed to improving urgent and emergent crisis response systems in Genesee County. And so what more of a crisis is there than a pandemic, right? So we really value our community partner relationships, and we really see our partnerships as the only way that we can accomplish some of these system level changes and improvements. So a couple of the areas that I'm really going to focus in on today are our law enforcement and what we're doing to partner with them, and some of the things we're going to be doing to partner with them. And so there's really two main areas of ongoing program expansion and development. Now, oftentimes, I will say we wait until we've already got something perfectly in place, it's already launched, and we're ready to and happy to tell you about what we've got going on. This is not the case. Every day is new with the pandemic. Everything is always changing. And so we are building the plane as we're flying it. And getting community input and having the opportunity to talk with groups like this is a really excellent way to make sure that we are not only getting everything going and following all the things we need to do, but getting community input along the way. And so one of the things that we're working on is something called a crisis intervention team. Now, this is an evidence-based model, and it's really innovative in the sense that not only does it have the evidence behind it, but it really looks at what does the individual community need. And oftentimes, evidence-based models or practices are really prescriptive. And what's nice about this is it has that element of what it needs to be evidence-based. However, it also allows for the community to tailor it to those specific needs of the community. And so that's what makes this such an interesting approach. Now, CIT, Crisis Intervention Team, is really a police-based crisis intervention with community healthcare and advocacy partnerships working together. And really, there's two elements to it. And I'll talk about those in just a minute. But the CIT model was first developed in Memphis, and people often say, are you using the Memphis model? And so you might hear people talk about CIT and ask that. It's really spread throughout the country. And one of the things that's really also grown the publicity of CIT is an excellent documentary called Joe and Ernie Crisis Cops. It's really, it's a documentary that's been produced. It's available on HBO. If you have HBO, you can watch it. There are short clips about it you can find on YouTube and things like that. And it's an excellent documentary to show how they have really implemented this model to help law enforcement interact with the mental health community. So CIT provides law enforcement-based crisis intervention training and really prepares the officers so that the safety of the officer, the person who they're interacting with, any family member, other citizens, anybody on the scene, the techniques used by this training are really helpful to make sure everybody leaves the scene safely. The other really important element to the CIT model is we want to redirect people with mental illness or people having some sort of behavioral health concern from the judicial system into the healthcare system. We don't want people who don't need to go to jail, right? And we want everyone to be able to leave that scene safely with the least restrictive options being available. So in order to do that, we have to increase the connection to mental health services right then and there. Law enforcement needs to increase the role of being able to offer or link those services and support and communicate that effectively to the people that they're working with. And an ultimate goal also is really to reduce the trauma that people experience during a crisis. There's been so much discussion nationally and locally about trauma that people experience when interacting with law enforcement. And so CIT is a vehicle in which we can provide training to officers and partnership with mental health to reduce as much violence and as much racial bias or implicit bias from those interactions. So the role of law enforcement is that trained CIT officers are able to interact with the crisis situation using the de-escalation techniques that it will improve the safety of everybody involved. Trained CIT officers strive to safely get the person to the appropriate facilities using the least restrictive possible option. CIT officers also collaborate with mental health professionals on individual cases as well as community response protocols. Now, this is a really important part. Community response protocols drive how we do things. They drive how we interact with one another and how social service agencies also may work together. So we want those protocols to reflect safety as much as possible. So let's talk about what the training looks like. CIT training is taught by a team of professionals, community members, law enforcement officers, mental health professionals, persons living with mental illness or substance use disorders, and community partners, each in their area of expertise, to provide foundational education and also assist with role plays in response to various scenarios. Now, this training is usually about 40 hours long for an officer. And during that 40 hours of time, it's designed to be consecutive, all in 1 week time. And during that time, not only do officers get that educational part, but the important element of being able to implement what they're learning in their day-to-day job. And one of the things that we know is that when officers are trained, traditionally, if they don't generally have a lot of mental health training and ability to have the perspective of persons living with mental illness or community partners, that they're going to be less effective in interacting with all of those various people. And so by role playing and giving them the tools to implement what they're learning, everybody's more likely to be successful. So what does the partnership look like? Everybody works together, law enforcement, mental health professionals, advocates, community partners. They meet regularly, they share information, they discuss community crisis response needs. So not only is there the training, but then there's this collaborative happening as well. And we're working to solve any community issues that people are having with our crisis response system. Law enforcement and mental health professionals really are looking to partner much more heavily than we have ever before. So let's talk, where are we at in Genesee County now? We know that we're building the plane as we fly it. So we're really in the planning stages. This started initially with grant funding. We are meeting regularly with community partner groups who are interested in CIT. We have watched the Joe and Uri documentary and looked at ways which we can implement things in our community. We've met with the police chiefs, and we're in the process of developing MOUs and some of those foundational things for crisis response protocols. And our goal is to have a training, one of those 40-hour trainings for any law enforcement officer in Genesee County within hopefully the next 6 months or sooner, if possible. And then also, we're looking to provide opportunities for dispatch to have training, as well as jail personnel with CIT. So related to this, there's an element in CIT that allows for mental health and law enforcement to have co-response options. Now, with the pandemic happening, it was really difficult to talk about co-response and putting people in cars together, and there were all kinds of barriers. And so we used some of our grant funding to develop a behavioral health urgent care iPad program. It is available 24 hours a day, 7 days a week, 365 days a year. People can call in and get connected and have a video chat session with a live mental health professional. You don't have to be in active crisis. You can just need someone to talk to at 2 a.m. if you're feeling stressed out. If somebody is in crisis, they do have the capability to provide a full crisis screening assessment and authorize some of the necessary services like psychiatric inpatient, crisis residential, or some of getting someone linked to outpatient care on an ongoing basis. You don't need a referral, and the services are provided at no cost. Now, with any grant program, we do have to collect insurance information if somebody has it and bill the insurance, but we won't send anyone a bill. And right now, there's no physical location. This is just a remote video chat service. We still have our existing crisis and text line. And the neat thing I'm going to talk about next is how law enforcement has direct access to the mental health professionals 365 days a year and 24 hours a day. So DHS is currently working to enroll any interested departments in the law enforcement iPad program. So this allows for any officer to have an iPad to carry with them. They can connect directly via video chat with a mental health professional. And that mental health professional can triage to help determine the next best steps for someone that they might come into contact with if they're not sure what to do. They can complete a supportive chat session right there and then. The person can take the iPad and have a chat right then. They can complete that full crisis assessment and authorize any services if necessary. And they can also link the person to ongoing services and continue to talk with them so the officer can leave. A unique feature of this is that we can also provide support to the officers if they encounter a difficult situation and they need someone to chat with as well. So what's next? This is under construction. Like I said, we're building the plane as we are flying it. And so we're continuing to expand the officer iPad program. Right now, we're mainly working with Grand Blanc Township Police Department, and we recently attended the local chiefs meeting, and we're providing information to them about how to get signed up with us to get an iPad for their patrol cars. And the idea is that we can offer this response widely throughout the community with the iPads in a way that we've never been able to do before. And so we're really excited to continue to get community feedback on how this is going, on things we can do to make this accessible to the community. And, one of the things that we're really interested to continue to do is expand the capabilities for other community partners and providers in the community to be able to have stations at their place of business and allow people to call in and chat with us if they're having a difficult time or need to get linked into treatment right away.
Thank you, Jennifer. I mean, it's just good information, and I'm already getting feedback of how wonderful this is and questions in the queue. So please continue to add those questions. There will be more to come. There'll be more updates on this program as we move forward. So thank you, Jennifer, for sharing with us today. And as always, people are excited and at the edge of their seats to hear from Dr. Susan Wolford. What's the medical update? What additional information about treatments will you share with us today? Dr. Wolford.
Thank you so much, Siobhan, for this opportunity to speak. To continue our discussion from last week about vitamin D. So if you remember, last week we started out talking about vitamin D, and we talked about the fact that it was going to be phase 1 of a 2-part discussion about vitamin D. So today we're going to do part 2. And so for part 2, I want to just comment on this issue of treatments for COVID. Many of us have seen a number of things on WhatsApp, and we see all these things that talk about the different kinds of treatments. And I just want to state that there are some things that are out there that we know are in fact wrong. They are dangerous. They are deadly. Don't do it. Right? So you see on your Facebook stream that you should drink cleaners and ethanol and methanol and spray your body with Lysol. We know those things do not work and they're deadly. Don't do it. Then there are things that are out there that people talk about for treatments that, well, there's no evidence that they help, but they probably won't hurt you. So if you want to eat garlic, drink a warm drink, have a humidifier of warm steam, it probably won't hurt you, but there is absolutely no evidence that it will help you address COVID. And then we have the things that we know there is strong evidence for that it does help, and we do use it. So if you remember, we had the monoclonal antibodies. Those are those clones, the antibodies that they can be given to help treat COVID. And then there are the antivirals like remdesivir, and then there are the steroids. We know those things work. They've done the right studies, and they should be used in the treatment of COVID. Then there are things that, well, there's limited evidence that maybe it might be associated, but we don't have the strong evidence yet. And vitamin D fits into that category. So I just want to say a little bit about it. Remember, I said it's like the conductor of a choir. It increases the work on one side or one group to get work more and sort of decreases the others. So it increases the work of your first line of defense in your immune system and gets that system, that innate system, the first system that starts fighting off the infection to work really well. But why we think vitamin D might be helpful and why it's worth doing more study in this area is what it does with that second part of the response to an infection. As you remember, we've discussed the fact that one of the things that makes COVID so deadly is that it causes your immune system to overwork, to overreact, and to damage your body. So I just have a little demonstration here. The way that it does this is because our body makes these things called cytokines. Our immune system has these cytokines, and we're going to think of balloons as cytokines today. And what balloons do, or what cytokines do, is that they attract immune cells to the area. These are immune cells. They attract immune cells to the area, and that helps to fight the infection. But you see, just a few immune cells are attracted to it when things are working well. But sometimes our immune system gets supercharged, overworks. It's really charged up, as you can see I'm doing here. And when it is really charged up, if you put it, it'll attract those things. See, right away, it's attracting a whole lot of immune cells. That is dangerous because not only does it fight the COVID, but it fights our own system and damages it. Well, if we think about vitamin D, if you pre-treat, for example, with vitamin D, we think about our anti-static here as a pre-treater. If you pre-treat it with vitamin D, then when the body or COVID tries to supercharge it, you can rub it. But when you then go to attract it, very few are attracted. You see, because it was pre-treated with the antistatic, pre-treated with the vitamin D. We think that that's the way vitamin D works, that in the way, if it's in your body, it helps to stop those cytokines from attracting too many inflammatory cells, and therefore allows the immune system to fight the infection without damaging our lungs or the other cells in our body. What we don't know is if it's important to pre-treat, or if you could give the vitamin D when you're already sick, and whether it will do the job then. We don't know that yet. So as with so much with COVID, we have to look for the studies. And so there are studies that are going on right now where we're randomizing people to either not get vitamin D, or I meant to say vitamin, not get vitamin D, or to get it when you actually are sick, and see if it makes a difference. But we'll have to watch the space for more studies to come out.
So Dr. Woolford, vitamin D is going to be okay. We understand now. So thank you so much. And we're just running out of time today, but we want to hear more from you in the coming weeks. The analogies are extremely, extremely helpful. And it leads us to why it's important for us to get our vaccinations, to know where they are. So Sherelle from the Health Department is going to give us a really quick update on what's happening in our county around vaccination opportunities. Sherelle.
Good afternoon. Do you all hear me?
Yes, thank you.
Okay. I am currently outside at a vaccination clinic, so you might hear birds chirping, but we have definitely increased our efforts. We are set up at low-income apartments this week, our churches, our schools. We are going to residences, and you're able to come to the Genesee County Health Department to get your vaccine. I just want to give some updates within the county. In the last week, there were 586 cases, which is a 40% decrease from last week. And we've seen a 40% decrease 2 weeks in a row. Currently in Genesee County, over 260,000 individuals have received all doses of their vaccination. And the Genesee County Health Department has administered 74,868 of those. We did, in the state of Michigan, reach 55% of first doses on Monday to be administered. So remote work is no longer required. Next slide. And I do want to share with you some of our upcoming clinics. All clinics are walk-in, so you don't have to schedule an appointment. On the screen, you'll see we have multiple listed. You can find this same list on our website at gchd.us. Visit it as frequent as possible to see where you can go to get a vaccine. We have which vaccine will be given at that location and the times. And one more update about the vaccine. We are now eligible to give the vaccine to our 12 and 15-year-olds, and that will be Pfizer. So again, there are no appointments necessary. You can walk in at any of the locations we have posted on our website. And if you have issues with reaching internet, or just unable to schedule an appointment online, you can still contact the Genesee County Health Department at 810-344-4800 for some assistance. We'll get you where you need to be. And I'm gonna wrap it up.
Thank you, Sherelle, and it's exciting. You're right out there getting the work done as we speak. This is real-time work, so we appreciate you as we move to look at how all of this impacts equity. And an equity brief has been coming out every week. Dr. Deborah Verholden and Mary Catherine Crawford are going to give us the update on our equity brief.
Hey, great. I got another talk I got to give them and toss it over to my wonderful colleague, Mary Catherine Crawford, and just give you one bit of good news. Things continue to go in the right direction. Third consecutive week of cases declining. Third consecutive week in Genesee County and Flint. Down 48% in the county, down 41% in Flint. And we keep testing constant, and the percentage of people who are testing positive is also going down. Folks, things are moving in the right direction. This is not the time to take our foot off the gas. stay the course, keep doing what you've been doing, honor those protocols so we can keep those trends going. I'm gonna hand it over to Mary Catherine.
Okay, great. Thanks, Jack. So, sorry. So some really awesome, great news I'm excited to share with you is that we have seen cases decrease by 50% just from last week alone across all age groups, except for our 70-79 range, which is, okay, because those were super low in the first place. What we're really excited to see is the drops for our youth cases, and then our young, 20s and 30s groups. And because of time, Marley, go ahead and we'll just go right into talking about our race data, which is improving. And this is only the race knowledge is improving. And this is because the Genesee County Health Department, our wonderful EPIs there and case investigators are getting some much needed aid from the state to help backfill this missing data. And so it's really exciting that we've been able to resolve that missing data by more than 20% in just the last couple weeks alone. And then, yep, thanks, Marley. And then I'll go ahead and just kick off right into recommendations quickly for you guys. So just as Michigan requires implicit bias training to educate providers on to prevent race-based discrimination in any kind of medical treatment, we really need to expand this kind of training to other population issues that are linked to health outcomes, including the disparate treatment of individuals living with disabilities, and really explore other ways that we can bake disability justice into healthcare settings as we're doing with racial justice. The next thing I was going to talk about is legislation that promotes good transparency and community research to identify needs of our county. And this would look like legislators putting forth some amendments to existing regulations that require hospitals to report and disaggregate data by race so that they can be quantified. And currently, reporting data in this way is optional, but it really shouldn't be a choice. And so we're really anxious to see the 2020 Community Health Needs Assessment from our amazing partners at the Health Coalition. In the meantime, you can read the last brief online. I will go ahead and put that right in the chat. And then what can our community do? If you see businesses, still doing things that are unsafe, please call that Michigan hotline number that we've been providing, 1-888-535-6136. Keep using the apps we've talked about, get people connected to services, share links and important information, and volunteer for your community.
Thank you, Mary Catherine. And this is so exciting that we have these opportunities. And want to go back and just say again, thank you to the Health Department for opening up these opportunities for both testing and for vaccinations, because that's what helps us to get to what we can do as a community to make a difference. We want our community health workers to know we appreciate you for sharing the information. So as a result of your request, we have continuing education units available for you through the webinar. Please complete the required information that helps us to make sure you get those credits. In addition, we want to remind the social workers, continuing education units are available for you as well. We do need you, please, to answer the questions in the survey that immediately follows the webinar. Those post-survey questions will allow you to get your information and for the university to contact you so that you can get your certificate. So there are 2 questions that we need you to complete immediately following the webinar today. We want to also ask you to like us on Facebook. It's so important that we can share this information with you. Subscribe to our YouTube Healthy Flint channel, and any questions that you might have, send those questions to info@hfrcc.org or give us a call at 810-835-2130. Now we're going to look for you next week, but I want to give you a little bit of teaser right here at the end of the webinar today. Next week, we already have lined up for you this great series, a session of presenters. Dr. Hackett will be back. Dr. Deborah Verholden will have Dr. EJ or Dr. Jennifer Edwards Johnson and Dr. Mona Hana Atisha. We're going to be focusing in on this conversation around children's vaccines. This is an important question that many are asking. So what does this mean? How do we get them involved? And it's important that you join us next week. So share this with your friends, neighbors, family members. Have them all join us next week for the 62nd Flint Community Webinar on coronavirus. When you do that, you help us to make sure that we're answering questions that are relevant to you right now in real time. So again, thank you for joining us today. And we look forward to you joining us again next week on for the Flint Community Webinar on coronavirus. Thank you for joining us and have a wonderful week.